Good morning, everybody. We're going to give it about another minute or two to let some people continue logging in here, and then we'll get started shortly. All righty, it is 10:01, so we'll go ahead and get started here. Good morning, everybody. My name is Tyler Finken, Health Marketing Director at Western Marketing. First off, just want to say thanks, everybody, for taking time out of your busy day to join us this morning. We've got a very, very good, informative webinar here with you this morning from our friends over at RSSA. We're going to talk about how adding the RSSA designation can add another level of credibility to your practice and open up opportunities in the Medicare space that you may have not known about before. So I've got my good buddy, Mr. Thomas DePaula, with us today. He is the Director of Strategic Partnerships over at RSSA. So one thing before we get started here, one thing I always want to mention is on the right-hand side of your screen, you should have a box where it has like a question mark in it. That is where I want you to type your questions during the webinar. And then at the end of the webinar, Thomas and I will address any and all questions that come in. So Thomas, thank you for joining us today. I appreciate you being here.
Yeah, thanks, Tyler, and thank you everyone for coming on the webinar today and learning a little bit more about what's out there for Medicare agents. And I will give you a perspective, just a little bit of background about me. Aside from working with the RSSA program, and there's a very specific reason that I do work with the RSSA program. When I first started in the industry, I started helping clients with Social Security planning. Now, what exactly is Social Security planning? I know that is very broad kind of understanding, but Social Security planning is when you're helping someone decide, just like Medicare, what is the best and right, instead of Medicare plan, what is the best and right time for me to claim my Social Security, right? What types of benefits can I claim? Retirement, spousal or ex-spousal, survivor benefits. There's a lot of rules and nuances that go into it. Yet, unlike Medicare, where there's a lot of agents there and ready to help clients like you guys for purposes of helping with Social Security, there's very few reliable resources for clients to get help. And so that's why we exist. RSSA is a Social Security designation program for you to help your clients with Social Security planning. Now, why would you help your clients with Social Security planning if you're a Medicare agent? Well, there's a very few specific reasons why you would help clients with Social Security to grow your Medicare practice. And I'm going to tell you a little bit about how I was able to do that. So instead of starting in the Medicare space, I actually started helping people with Social Security planning first. And what I started to realize is after many clients kept asking me the same question once I would help them with Social Security, they kept saying, now I need help with Medicare, right? What do I do with my Medicare insurance, right? To the typical 65-year-old, we have to realize that they're getting mailers, invites to events. Everyone wants that new to Medicare business, right? We want to get new clients. We want to open up relationships. We want to close more deals. But we have to realize that every single agent around us is doing the same thing. And what is differentiating one agent from another, right? Think about what you do differently than other agents. Can you really say clearly, I do this different? Most people can't say they do anything different. And so by leading in with another important topic like Social Security, that could be your differentiator. And for me, that's what it was. So after clients kept asking about Medicare, I decided to get my life and health license because I wanted to be the one there to help them with their Medicare, right? And so it ended up creating this huge funnel or T65 pipeline of new to Medicare opportunities that haven't been reached out to any other agents yet because I was able to help them from 62, 63, and 64. Now, a lot of agents will say, well, I don't want to wait 1, 2, 3 years to get those leads to sell them Medicare, right? Well, here's the thing. With the landscape today, we have to realize that it's not just a short game, right? We have to think about the long term goals, how this can help us grow over the next 5, 10, 20 years from now, okay? If you're on the tail end and you're thinking about retiring, maybe this is not something that is suitable for you. It could still be because maybe you want to help clients with this on the side in retirement. But for those agents who are really looking to grow and use something like this over the next several years, we have to realize that this is the time now to differentiate what we're doing. With all the Medicare changes and commission cuts, what are you doing that's going to continue building your book and getting in front of more clients, selling products that have commissions, right? So there's two ways that you can use this program that we're going to talk about today. You could either use it as an added value to attract more leads, potentially before 65. You can use it to get in the door with people to help them with Medicare. Maybe you realize that you want to start selling other products like life, annuities, things like that, and this can help with that as well. Because it's not just a transaction, but this is an educational approach. And that's how I always used it, is getting in front of people, helping them with Social Security leads to organic and naturally flowing opportunities for other product sales, including and especially the Medicare products. So the good thing about Social Security planning and the RSSA program is that it combats some of the barriers that we're facing today as Medicare agents, right? For instance, we talked about the competition, right? Everyone is trying to get that new to Medicare, new Medicare opportunities, T65s. So is everybody else, but we need something different. So that's what I love about helping people with Social Security, is that not every client has a 401k or a Roth IRA or all these other retirement income streams, but a universal topic like Medicare, like Social Security, is the way in the door. And once we get in that door and we can show clients, not pitch them the product, but show them how these products give them the best overall outcome for retirement, helping them optimize Social Security, getting them on a healthcare plan that is affordable for them so that they're not paying a ton of money out of pocket, increasing their Social Security to offset that even further. And next thing you know, instead of just another agent, you are a trusted advisor. Now, another big thing with Medicare today is CMS compliance. How many people here, and this is a rhetorical question, but how many people here are frustrated with what we can say and what we can't say, how we can market and how we can't? Are we afraid of the CMS and what we can do and things like that? With Social Security planning, it's not regulated by CMS. So it gives you the flexibility with reaching clients, not having to worry about a scope of appointment, putting on an event and providing a meal. All these different things that you struggle with Medicare, they don't exist with Social Security, and it creates that low to barrier way in the door with prospects, making appointments, and then turning the Social Security conversations into Medicare opportunities from there. So again, we want to find a topic that resonates with as many prospects and clients as possible. And aside from Medicare, which we're trying to do more of, we also want to find another topic that is just as important, if not more important, than getting their Medicare claim right. And that's where Social Security comes in. The majority of Americans rely on Social Security as their largest retirement asset. However, again, a lot of people get it wrong, right? There's a lot of people who leave money on the table because there's not many professionals out there to help them like there is for Medicare. So we train Medicare agents, insurance agents, all kinds of professionals to integrate Social Security planning as part of their practice. And again, you're doing that for a few reasons. You're helping people, you're getting them more income, leading to opportunities for Medicare and other ancillary products. Now, the average American household leaves over $139,000 on the table as far as their Social Security benefits in lifetime benefits. And the main reason for that is that there's few reliable resources. There's nowhere for these people to go to get the help, right? And I've actually talked to a few agents who say, hey, I'm already helping my clients with Social Security, but I just want to make it clear. Helping them file the application is not helping them with Social Security. If someone comes to you and says, am I eligible for a benefit on my ex-spouse? Can you confidently say you know all the right questions to ask that client to make sure that they're eligible? Do you know the difference between retirement, spousal, survivor? Do you know how to explain if they make a decision today, how that's going to impact the survivor benefit 5, 10, or even 20 years down the line? This is not about helping people apply for benefits. It's helping them make the decision that is probably the biggest retirement decision that they'll make, and it's a one-time decision that they need to get right. Otherwise, they're going to fall into this category and be like 96% of other people who leave money on the table, right? Now, comparing it to Medicare, there's too much generic answers as far as Social Security goes, right? You know, there's a lot of people that say just collected 62 or just collected 70, right? Throwing these random things around. Now, if you tell a client, go on this plan over here, go on that plan for Medicare, and they go to their doctor, they go to get their drugs, they go to the hospital, and they're not covered, they're going to come back to you and say, why did you tell me to do this? This wasn't the best plan for me. They don't even take my they don't take my doctor's drugs, anything. It would be the same comparison as telling someone to claim Social Security at a certain age without understanding why behind that. Why are you telling someone to do something? You don't know their circumstances, right? They're listening to their neighbor, their brother, even financial advisors are giving too much generic information. So just like you're doing with your Medicare clients, you're using a CRM or software to put in their doctors, their drugs, everything that's involved to get them on the right and best Medicare plan. Well, our software that we're going to show you today does the exact same thing, but for making sure they get on the best Social Security plan. So it's going to ask you for their name, their birth date, their marital status, their work status, things like that to create a personalized plan for when and how to take their Social Security benefits. We do that through our platform and ecosystem, right? We give you a turnkey solution and training on how to integrate this into your practice. Not just being educated, but how to use all the tools, the marketing, and the resources we provide you to get out there and start using this to grow your practice. Again, some use this as an added value. A lot of our members, they actually charge a consulting fee for this. So again, with Medicare commission cuts, we're trying to make additional income. The average RSSA charges around $500 per case. You do 2 new cases a week, you're looking at an extra $1,000 a week in income, right? That is conservative. We have people that work with 5 people a week, 10 people a week, charging a fee for this service. Regardless, it's going to lead towards Medicare opportunities and any other ancillary products that you provide as well. Now, we give you the education, we give you the software, back office support. We have a full training platform on how to use this and monetize it for your practice, how to market it. And we have a marketing platform that gives you all the content you need. So we're going to talk about all these things through the next few slides. So the very first thing you're going to do is go through our 5-module educational course. Okay, going through education, not the most fun thing. We all have to take AHIP every year. I know it's annoying. We have to do it. We have to take research. The good thing about this is that it's a one-time certification process. You do it once, you never have to take the certification process ever again. So it's not like AHIP and research where you have to do it every single year. So although, yeah, it's going to take you about 20 hours to get through it and then take the test, after that, you're good. You don't have to worry about it. So make the sacrifice now, because next thing you know, we're going to have research that we have coming up, AHIP, then AEPs here before we know it. So right now at this point in time, a lot of agents are getting it done so that you can start using it. So once you get through the 5 modules, you're going to sit for the final exam. The final exam is independently proctored online. You can take it at home or at your office. It's 2 parts. The first part is multiple choice, and the second part are 2 cases using the software. Now, you just need a 75% to pass. So most people are passing within the first or second try. We have around an 87% pass rate on the first try and even higher on the second. As part of the package through Western Marketing, you're going to get 2 exam attempts included. So that's why we provide that 2 attempts, because most people, the majority, will pass within the first or at most the second attempt. Now, as far as our education partners and CE credits, we are approved by many platforms for CEs. That includes the FI 360 Broadridge Company credentials, the IRS, NASBA, and the CFP board. For insurance agents, we're approved in 47 states for CE. Depending on the state that you're in, the majority of states provide 9 credits. There are some states with more and some states with less, but out of the 47, the majority provide 9 credits of CE. Now, we're also part of Kaplan. We're partners with Kaplan and the American College, so that you know this is a really serious and credible RSSA designation, okay? We work with AARP, we work with the American College. We want you guys to know this is something we built out to really help our members, including insurance agents, financial professionals. Now, as far as the marketing platform aspect of it, if there's anything you ever need or you want to co-brand, we're here to help you. But we also built out a pre-established marketing platform. We give you consumer-facing brochures, flyers, postcards for postal mail marketing. We give you a whole suite of social media content. If you're looking to build other B2B relationships with CFPs, CPAs, eldercare attorneys, we have all the content for you to be able to do that successfully. You're also going to receive your own RSSA landing page that you can see here on the screen. This is going to allow you to customize it with your pictures, client reviews, professional bio, upcoming events if you want to host events. If you have a website for your Medicare business or any other ancillary products that you sell, you can link that here and then vice versa. A lot of times we'll tell people, add Social Security as part of your service offering. You're going to get a bunch of people to come and get help with that. And then lastly, we put you in our directory where we have consumers that come to our website looking to work with someone in their area. They'll be able to contact you directly. Now, we are seeing a huge uplift in consumers that are coming to our website because we're growing, right? We're growing the brand, not just to advisors and agents, but to consumers. So there's been people that literally are getting sales right after they're certified just because of the leads that are coming directly to them through here. And those come at no additional cost. They're included in our program. Now, for anyone who's put on any kind of like a Medicare 101 or any kind of event, Social Security events tend to have very good attendance. We're basically seeing a 20 to 30 people attend based on a 2,000 piece mailer. But more importantly, what we're seeing is the people at the events are turning into appointments and sales opportunities. We had many people put on events so far, and they're just killing it. They love it. They do 1 a month. Some people do 4 a month. It's crazy. But how we help you with events is giving you ideas of where to host events that have been most successful. We give you information on how to host webinars versus in-person workshops. We provide you with a customizable slide deck that you can use. It comes with speaker notes, and we give you training on how to put on a successful event. And again, with CMS, these events give you that flexibility with how you can put on an event, gathering the client's information, everything like that. So the next thing I want to do is show you the RSSA roadmap software. And this is going to be the technology that you use. And not only are you going to see today how easy and quick it is to use, but what the client is going to receive when working with you. So I'm going to click on a sample client case here. And in this case, all of the information has already been entered. But even if we're entering it for the first time, which we're going to show you, it really only takes 5 to 10 minutes max. So it's not going to take a whole lot of time. We're entering data like their name, their birth date, their marital status. This does take into account whether they're single, married, divorced, widowed, dependent benefits, all the different things that go into their Social Security decision. Those questions will be asked according to their situation. So in this case, we put that there's a spouse, so we'd enter the spouse's information. Very similar information from the first spouse. It doesn't really matter which spouse you put first or second, but all the questions are pretty similar. But again, if you have an ex-spouse or a deceased spouse, it's going to ask questions based on that specific person, right, and what their circumstances are. The next thing is entering the client's earnings. So most clients or many clients have an SSA.gov account. If they don't, we have the links here that they can either sign in or to create an account with SSA.gov. And once that account is established, they have the ability right from their account to download their Social Security statement as an XML file, real easy to do. And we can upload that XML directly into the software, which pulls in their earnings every year that they've worked from the start of their career all the way through the current or last year that they've worked. And this is going to do the most accurate calculations possible. We also have the ability to put in future earnings. So if clients plan to work another 2, 5, 7 years or whatever it is, we can let them know how they can increase their benefits by continuing to work. And there's also several other strategies of how to help people increase their benefits. A lot of people don't know this, but when we teach you through the course, you're going to learn how you can significantly help someone get a whole lot more out of Social Security than they originally thought. So lastly here, we have our built-in fact-finding tool. For any of you guys that sell other ancillary products, fact-finding, needs analysis are really important, but we want to build it right in, right? This makes it flow more organically than just having them fill out a form asking for all this information that they're like, why am I filling this out? What are you trying to sell me? Instead of doing it that way, it's easier to build it into this. And basically, they're seeing that this is all interrelated to their Social Security plan, right? But for you, if you sell other ancillary products, this is going to open up the door organically to not pitch those products, but show the client how they fit in to their retirement planning that goes on. Now, we ask questions like what's in their 401k, what's in their Roth. We ask them about their retirement savings, their real estate. They can put in debts, expenses, and if they have certain insurance products, right? And there's also a box where they can put in additional information. So none of this information is incorporated within the report that gets created, but this is for you to upsell other products. So the very next thing you would do from here is to download the personalized report. The report's all automatically generated. But before we get to there, I want to point out some other key features that you'll have access to as well that are also built in the report, but you can view them within the software and outside the report too. So the first thing I want to show you is the filing options heat map. This is going to show every single option from 62 to 70 and show that in either a lifetime, annual, or monthly benefit view. Now, you can also click on any option within here, which will break down the details. So to show you and explain to the client, are they eligible for retirement benefits, spousal, survivor, dependent benefits? Are there any earnings deductions? And as you can see, these are shown annually, but you can also break them down to monthly benefits too. We also provide the Social Security calculations, right? So a lot of clients want to know where these numbers are coming from. So we actually give them a breakdown of their Social Security benefit calculations. And this will also help us explain how they can increase their benefits. We also provide a break-even report, which can allow you to compare up to 4 different options at once, or you can uncheck certain options and change the ages accordingly to show different break-even scenarios. We also have a tax calculator. You might not use that much, but we do have a lot of tax professionals in our program that this will show the client how much, if they'll pay taxes on their benefits in retirement. But more so what you might use, which is just being updated right now for the 2026 numbers, is our Medicare IRMA calculator. So you'll be able to put in the tax filing status, joint, separate, or individual, change the income range, and then it'll tell you if and how much the client will pay on their IRMA. Now, what's great about this software is that you can white label it. So if you have a company or agency or whatever, you can put your logo as well as your information. And it's almost as if it's your own technology. So it doesn't look like it's a third-party technology. Your client will make it seem like it's your own internal technology that you're using. You could also download the report either in English or in Spanish. Other languages are coming as well. And then you can download it either as a PDF or a Word file if you want to make any edits or changes or add-ons or anything like that. So for simplicity purposes today, I'm just going to download the PDF version. Now, again, by going through this with a client, you could either use this as an added value or to charge the consulting fee. A lot of clients see this very valuable because what you're basically doing is walking them through everything they need to know as far as collecting Social Security. The different benefit types, we'll talk about the different key information and how this impacts them and what they should know out of these key terms. We'll talk about the different benefits they're eligible for and if they're eligible for more than one benefit at the same time, if they're eligible for one benefit today and another benefit down the line and how those two work in tandem. These are all the things that people have questions on and what we teach and how you'll be able to help your clients. We also provide a monthly and annual heat map so they can see all of their numbers and all of their options at once. And then we provide them with a claiming option summary. Now, this is going to outline their lifetime, annual, and monthly benefits for each of their options. And they even are provided with this filing sequence, which we tell them when and what to file for. We want to make things very clear for them. We also talk about survivor benefits, right? This is a great opportunity to talk about all sorts of ancillary products, right? Life insurance, annuities, final expense, hospital indemnity, right? All these different things, if that's something you do. If it's just Medicare, that's fine as well. But remember, the big key this year is diversity. So you should think about offering other products as well as Medicare. We also have a lifetime benefit chart showing them what they can receive over their lifetime in benefits, but we also give a longevity comparison. The number one concern for retirees is outliving their funds because over 48% of people are forced to go back to work later in life because they ran out of retirement income. Now, how do we offset or mitigate that? Well, again, it comes down to helping them get more dependable income from sources like Social Security, get them on the best and right Medicare plan to lower their healthcare costs. These are all the important things. And again, any ancillary products that can fit in there as well. If you want to help them apply for benefits, we teach you how to help them apply for benefits online. You can either help them do it more directly or at least just give them some information on how they can do it on their own. And then we provide those 4 different options detailed out in the appendix section. So we try to make the report very simple and user-friendly, be able to walk clients through it, whether you're using it as a value add or to charge a fee. And again, this whole process is a great opportunity to get in front of more people, open up conversations about Social Security and Medicare and other products, and help grow your practice, especially with the landscape we're seeing today. So if you're interested in doing this package, we have a great discounted rate with Western Marketing. For being on this webinar today or viewing this webinar, we're going to be able to provide you with an even further discount if you decide to do this today. So the package includes the course, the exam, and you get a second attempt if you need it, as well as the certification. You get the RSSA roadmap software that we just walked you through. You get ongoing training, so we teach you how to integrate it into your practice, right? We give you all kinds of on-demand and live training to build this out and market it. We give you all the marketing content and then any back office support that you need. So I will tell you right now, because I've been doing this for a while, I would love to mentor anybody who does this, right? So I can teach you exactly how this works, how to build the practice doing this. We want to give as much back to agents as possible. So anyone who decides to do this, I'm happy to work with you. Our team's happy to work with you, and we want you to be successful. So the normal pricing without any discount through Western Marketing is $3,395 for this package. If you enroll through Western Marketing, you can enroll anytime throughout the year for the standard discount, which is $2,400 through Western Marketing. Now, anybody who's ready to get started today, we wanted to provide you with an additional $300 off. So if you're ready to go, take advantage of the discounted rate today. That comes down to $2,100. So if you're interested in that, Tyler, maybe you can put in the chat rssa.com/RSSA-program-package. You're going to use Western 42 at checkout. We will send a follow-up email letting you know about all this, but you can type in this in your browser, and when you check out, you're going to use Western 42. That'll give you guys the discount. And like I said, we'll send out a follow-up email. So Tyler, what questions do we have so far?
Let me take a look here. Certainly appreciate you giving such a generous discount, buddy. That's awesome. I would definitely be taking advantage of that right away if I were an attendee here. I don't see any questions as of yet. We usually do have some pop up right at the end here. So again, on the right hand side of your screen, there is a questions box there. You can go ahead and type those in, and Thomas and I will get those answered for you. But yeah, that's a heck of a discount, man. I'd definitely go there and get signed up as soon as possible if I were you, and get that RSSA designation.
Yeah, it's a great program, and like I said, we want everyone to feel like this is a good investment. So we're gonna, just so you guys know, on the call today, we're gonna be working with Western Marketing to do a lot more training on being successful and getting out there and using this, because we are seeing a lot of agents find success, and we want to replicate that across Western Marketing, give back as much as we can. So like I said, think of this as an investment for your practice. Most of you are business owners, you can write it off, but it's a great opportunity, especially if you're looking to grow and help more people, and build out your practice, and also retain your current book as well. So yeah, Tyler, if there's no questions, we can kind of end early for respecting everyone's time. But I'll reach out to you, Tyler, and we can send out a follow-up email to get everyone the information.
Yeah, that would be fantastic. There is a question that just came in, asked if there are any payment options for the 2100.
Yes, we do have payment options at checkout. They are third-party options, but we do partner with Klarna, Afterpay, and PayPal. So I think Klarna, you can get it for like $100 a month, and you could always pay it off early. So there are payment options at checkout, absolutely.
Okay. That appears to be the only question as of right now. So like Thomas said, we will give everybody back some time in your day here. Certainly appreciate everybody jumping on. And if you do have any questions, feel free to reach out to me or anybody on my team over here. You can reach us at 800-852-7152. Again, that's 800-852-7152. Second question came in asking where they can check out and purchase this.
Yeah, so just type in the browser rssa.com/RSSA-program-package. Tyler put it in the chat for you. That's going to bring you to a page where it says enroll now for the $33.95. So you'll click on enroll now, and that'll bring you to the registration page. At the very top of the registration page, it'll have an area that says to enter a coupon code. That's where you'll put in the Western 42. Which brings down the pricing to the 2100, and then you'll fill out your information and submit your payment, and be able to sign up from there. As soon as you sign up, you'll have full access to the program. You'll be able to start the course right away.
Perfect. All right. That is all we had for today. So thanks again, everybody. Thanks, Thomas. Certainly appreciate you, and I hope everybody has a great Thursday and a fantastic and long and safe holiday weekend.
All right. Thanks, Tyler. Thanks, everybody. Hope you have a great rest of your week.
All right. Thanks all. Bye-bye.